So, Willem de Jonge, you're the General Director of Medecins Sans Frontières in Greece. Now, your organisation has a reputation for working in the world's biggest trouble spots and amongst the biggest disasters. You're known as the first in, last out type of operation. So, many people will be surprised to hear that you're operating in Greece. Could you just explain why you're on the shores of Europe now?
Okay. Well, MSF has been working in Greece as a fundraising office for 2 decades now, since the early 1990s. So as a standard operation, we've been there to benefit from all the positive things of Greece, such as its highly skilled labor force and fundraising capacities in Greece. Nevertheless, during those 2 decades, MSF has also had to respond on several occasions to should we say, mini crises. We've had earthquakes in Greece. We've responded to homeless people in Athens many times. We've done different work with migrants arriving on the shores of Greece, needing some assistance. So despite our fixed presence for fundraising purposes and for recruitment purposes, we've also had on and off responses. Now recently, as a result of the economic crisis, we've been analyzing the situation and we feel that there's a need currently in Greece also to support the people of Greece. As the economic crisis has deepened, the effects on their healthcare has also increased. And so this is why we are continuing to operate in Greece today.
I mean, we hear all sorts of stories about what the effect of the austerity measures are in Greece. And we've heard some disturbing stories about healthcare and the availability and cost. Could you just briefly explain how you see the situation from your experience on the ground?
Well, the crisis in Greece is an economic crisis, but it's also led to, should we say, a social crisis. A breakdown of the social fabric, if you will, of particularly the most vulnerable groups. As in every crisis, it's the most vulnerable groups that are hardest hit. So then we're talking about, for example, 27% unemployment at the moment. Those kind of effects of the crisis means that many of the households in Greece have a far reduced disposable income. And every household has to spend a certain percentage on food and rent, but also a certain percentage on healthcare. So that the capacity for families to spend money on healthcare has decreased dramatically. At the same time, funding from the government for healthcare, or should we say budgets of the government for healthcare, have also been hard hit by the austerity measures. For example, the budget since 2007, the hospital budgets have been dropped by 40%. These kind of numbers show that the pressure on the healthcare system is very large. Now, another factor that's contributed as a result of the decreased income of the families is many no longer have the ability to access private medical insurance, which is very common in Greece. You have a public healthcare system, but it's very culturally very normal, should we say, for them also to have a private medical insurance. Now, with far fewer people being able to afford that, there's an increased demand for the public healthcare system because they no longer can afford the private doctors. So at the same time, you have a decreased budget and an increased demand for the same services. So from both sides, there's a lot of pressure on the public healthcare system. Furthermore, I think the other main issue for us that we see is, shall we say, the human vulnerability of the people of Greece as a result of these factors that I just mentioned. What you see is that living conditions have deteriorated. Many people are living in homes together. The ability to should we say, to remain healthy becomes more and more difficult, and especially for the most vulnerable groups, the homeless people, the drug users, migrants on the streets of Athens. In those groups, you see a specific risk of increased risk for communicable diseases, infectious diseases, such as tuberculosis, such as HIV/AIDS. These types of diseases we fear we see also increased numbers with those diseases, and that's why, and that's an area where MSF can have a specific added value.
Okay. I would like to come back in a moment to the size of the cuts, but at the moment, I mean, are we seeing Are we seeing these diseases that perhaps we're on our way to controlling or banishing altogether?
Yeah.
Coming back?
Yes, we've seen one in particular, but not just one. I'll go into depth about malaria, which is after 40 years of having been wiped out of Greece and most of Europe, in fact, has reappeared on the shores of Greece, in southern Greece. I mean, many European countries have cases of malaria from tourism, people that go to Africa or Asia and then bring malaria back with them. What hasn't happened in Greece for 40 years is a local transmission of the disease by the mosquitoes. From one malaria, should we say, patient to the next. Thank you. And this was of great concern because, of course, the local doctors in the southern Peloponnesos in Greece were not familiar with the disease. They didn't know how to diagnose it. They misdiagnosed it. They didn't know how to treat it. And so this was an area where MSF felt it could have a specific added value because we know the disease very well from our work abroad. And it was a very, should we say, I think, timely and relevant intervention where we supported the local healthcare structures with training, with microscopes, treatment protocols, and prevention to try and tackle this outbreak of malaria. Now, when I say outbreak, numbers are still relatively small. We're not talking about Burma with 70,000 cases. We're talking a few hundred cases. Nonetheless, it was very concerning for the local population because it was a disease that they thought had left. And linked to the economic crisis, one of our analysis was that one of the many factors that led to this outbreak was also the reduction of budgets by the federal government for spraying, in other words, for controlling the mosquito population. So there are many factors that have led to malaria returning to Greece, but definitely a contributing factor was the lack of ability of the local governments to control the mosquito population.
I think most people who have experience of Africa will hear what you've just said. Mm-hmm. And although you're very clear that at the moment we're talking about low numbers,
yeah.
But that is deeply concerning news that there may be the beginnings of return of malaria to the European mainland because that has all sorts of secondary and third level effects throughout society.
Yeah. Yes, it definitely was concerning. Especially considering the fact that it had been effectively, we thought it had successfully been wiped out. I feel that with the training we've given, the government and as the crisis eventually will hopefully fade away, we'll be able to take control back again. But absolutely, because one of the other factors which you can't link directly to the crisis is simply the reemergence of the mosquito that transmits it, because it's not just every mosquito that can bring you malaria, it's a specific type of mosquito. So that mosquito, if it has large numbers or low numbers, will still be present on the shores of at least of parts of Greece. So it's most definitely a concerning thing. At the moment, again, it's not huge, and my family lives 20 minutes drive away from where we had our project in southern Greece, and there's absolutely no issues there. It's very localized, but it's a concerning trend. Together with the increased rise of HIV/AIDS in the center of Athens, together with reduced capacity to tackle these types of diseases by the government due to the austerity measures, all these trends are concerning.
Yeah. I think they must really be very, very grateful that an organisation like yours is there, because your experience of malaria, which is a far more widespread and complex illness than many people understand, must have been a real blessing. Yeah.
Well, I would like to think that they were grateful. Yes, the government and MSF, we work closely together to try and tackle it, and we're going to see this year, 2013, how it goes. Because the season is starting now in April with the malaria season has come back, the mosquitoes have reappeared, so we're going to see how it goes this year.
Okay, but just to be clear, this is more of a symbolic example rather than the most concerning example.
Yes, I would say so. Yeah.
I think we need to be very clear, don't we? Now, you mentioned also that one of the reasons for the return of malaria, for what it's worth, is one of the effects of this 40% cut.
In hospitals.
In hospitals, yeah.
You'll read different studies. I've been reading on the plane, different studies give you different percentages, but the one number that does seem to be persistent is the cut in hospital budgets, for public hospital budgets. And that affects, and they've achieved those cuts through cuts in salary, through a reduction of staff, and through other measures. And it is very concerning. Directly, MSF has not. We don't work in the hospitals, so we haven't witnessed the effects of that. It's a number that we know is there because we have staff members that work in the public healthcare sector, or former expatriates that come back into Greek society and work in the hospitals. We know it's a heavy burden, and in particular also because there's more and more people accessing the same hospitals for healthcare, which we call it, say, double whammy. I mean, there's less capacity and more demand. So this combination is obviously a huge strain on the healthcare system.
The other thing is that you've been saying that with your experience of sending doctors abroad, which is where you get your name from. Yeah. Are you beginning to see Greek healthcare experts come back to Greece to help out? Is that a phenomenon?
No. In fact, we've had increasing difficulty in recruiting doctors in Greece. What we've seen, and I don't know if this is a trend, I can't comment on how it affects the whole country, but we've noticed in our own recruitment that we've had more difficulty recruiting doctors, and our own analysis has been that's because doctors that are unemployed, these are the highly skilled labor force. They have opportunities in countries like America and Australia to be employed. Whereas a logistics person or an accountant, or they may find more difficulty in getting jobs elsewhere. But the highly skilled specialists and doctors, they tend to be seeking employment outside of Greece. So we've struggled actually. I thought that I came to Greece knowing it was a crisis, expecting to find it easy to recruit people, but the opposite has been true for medical staff.
Yeah. I mean, this is also a bit of a long-term concern because it's kind of, as it were, brain drain.
Could be, yeah. I think we're a small organisation. We send out just under 100 people per year through, from Greece to our office outside. So I wouldn't be able to extrapolate that onto the whole country. But yes, if that were to happen, of course, it's a concern. I mean, I think it's general knowledge that there are many Greeks seeking employment outside of Greece, and that's a concern always.
And also, to be fair, there are many Greeks, as you're saying, you're sending 100. Yourself, there are many Greeks who are working around the world for the benefit.
Yes, of course. Yes.
So, yeah. What I would like to kind of just discuss now is that you're one of the recipients for this 12 hours for Greece. What would you intend to do with the money?
Right. Well, first of all, I think the initiative is great. It's an initiative that we've seen actually arise in also other countries. Here, it's not necessarily the Greek population. It's actually friends of Greece, non-Greeks necessarily, here that are doing this action, this initiative for 12 hours of Greece. Other countries, like in America, we've seen Greek communities lobby together to fund projects in Greece. So the initiative, I think, is really good. I think Greece needs it to get that support, not just financial but also moral. To show signs from outside that there are people that still, want to support Greece. And concerning the money, well, the project that we're just about to start now is tackling these issues that I mentioned before about these communicable diseases affecting the most vulnerable groups of the Greek population. We believe that they have been disproportionately affected, as is often the case in crises. It's a typical MSF approach to try and support the most vulnerable of a population, and in Greece, these are the ones that run the highest risk of these types of diseases that I mentioned earlier: tuberculosis, HIV, malaria. You're talking about the homeless people in Athens. You're talking about the drug users, a migrant population in Athens, people that find it extra difficult to access, a struggling public healthcare system. And so our project will be focusing on those. We'll be working together with the municipalities, the local municipalities, in providing healthcare, and through these municipalities we'll be able to get an idea of where the people are and what's affecting their health and what kind of diseases they have, and that'll help us improve our operations as we go on. So it's really for those, the money will be allocated to that project.
Okay, but I mean also, given how your role has changed in the country, and your expertise of other countries with healthcare systems that are really in crisis.
Mm-hmm. Yeah.
How much longer can Greece carry on down the path that it's on at the moment?
You have to ask an economist that.
Okay.
Yeah, that's difficult to say. We are going to try and help. I mean, our analysis is always we will help as long as we're necessary. Every project we start anywhere in the world has the ambition of stopping. Every project has a start date and has immediately during the startup phase you already determine your exit strategy. Whether it be a project for 5 years or for 6 months, we're always thinking like that because we shouldn't really be anywhere and definitely not in Greece. So our ambition is to help as quick and efficient as we can and leave. How long the Greek government can continue, I think that I'm afraid you're going to have to ask the economists.
I mean, of course, I don't want to bring you into areas outside the remit that you're working in. But I think, once again, people will be alarmed at an organisation with your reputation.
Yeah.
It is in Greece. I mean, when you travel, because you're obviously looking for support, are people surprised that you're in Greece? Are they shocked? Are they...
Yes, many of them are, although I remind them that we've had projects like this in Greece ever since we first started in the early 90s. Earthquakes, floods, homeless, migrants, these kind of things we've supported, and not only in Greece. We've worked in Italy. We currently have a project in Milan, if I'm not mistaken, or Rome, also supporting the homeless and the migrant population. We were present in Lampedusa during the Libya crisis, which was again a refugee influx, but nonetheless it was on Italian soil. We've had projects in the heart of Paris, supporting also there the most vulnerable and migrant populations in Paris who struggle to access healthcare. There we've had projects in Spain. So it's not totally uncommon for MSF to work in what we consider home societies, countries where we traditionally collect money and recruit people. So it's not a first or a last time that it happens in Greece. But this particular project and our current concerns are linked to the economic crisis affecting the general Greek population, which is slightly... The other projects usually had very, very specific target populations, and we do too now, again, the most vulnerable, but it's as a consequence of the global economic crisis, and that is a little bit new, and that surprises people sometimes. But the basic idea of us working in European countries is not completely new. It just not many people know about it because it's small numbers, it's low profile. It's not our main, should we say, calling card.
Yeah, quite. And I would just like to finish off on a question. We've seen also when we look at the situation in Greece, there's an argument that you can say that the austerity and the severity of the crisis has brought out the worst in people, and we can see that with some political excesses. What I would like to ask you about is the reverse. Has this also perhaps brought out the best in people somehow? Have you got any examples of
Yeah, I think I like the question because many people tend to focus on only the negative. What you see, I think, what I've seen in other countries is when you get this political movement to the extreme right, you tend to, with some delay sometimes, but you tend to get indeed the opposite movement. And in Greece, you've seen that there's been a lot of solidarity, should we say, marches, or there's been events held, a lot of anti-racism rallies. So I do believe it's happened. I've seen also initiatives pop up out of the ground, but it's very, very grassroots because the money from the Greek people to support Greek-based, should we say, initiatives is severely lacking. I mean, our fundraising has plummeted in Greece. I mean, the Greek people, if they struggle to pay for their fuel and their healthcare and their food, then they don't have a lot left over to give to organizations like MSF or other organizations. So the initiatives have really been community, people-based initiatives without a lot of money, but showing indeed their solidarity and all the best parts of Greece. So yes, I have seen that on the streets. I've seen that in the work we do. But it's still the situation is still concerning because effectively what I've seen also happen in my own home country of Holland is that you get a polarization of the population and that of course always remains concerning. It's very difficult to live in Greece today without being confronted with the negative effects. But luckily there is a counter. The countermeasures are growing, and I think that's positive. But it's a difficult time in Greece.
Okay. Well, thank you very much for your time.